residents living in our communities are often prescribed wheelchairs and other mobility devices. It is our job to make sure that our residents are using their devices appropriately and safely. Some residents will simply require reminding. Remember, Mr. Smith, to use your walker on your way to the dining room is good enough. However, some residents will require full assistance. Always review your resident-specific service plan to be sure that you are providing the appropriate level of assistance with their mobility devices. Let's review some care fundamentals associated with the use of wheelchairs, walkers, and canes. First off, never prescribe the use of a wheelchair, walker, cane, or other device for a resident. That is the role of the physician. While it may be tempting to allow a resident to use someone else's walker, etc., just for a few minutes, you may be setting up a very dangerous situation. Mobility devices and wheelchairs need to be prescribed by the physician. And once they're prescribed, the resident needs to learn how to properly use these devices. So they will often have training from a physical therapist that may even visit your community. Be sure to ask questions about your residents' individual devices so you understand how to properly assist. If you notice that your resident has a change in the way they're ambulating, by all means, report this to your supervisor. It could be a medical condition that requires intervention. If indeed your resident will now require the use of a mobility device, then the physician will order such a device. Of course, the resident will need instruction on the use of this device. It is our job as a caregiver to remind the resident and provide assistance. However, it is not our role to train a resident on a new mobility device. That requires a medical professional. As a professional caregiver, it's our job to monitor the condition of the resident's mobility devices. Now, we are not expected to be repair experts. We should never adjust a mobility device, remove parts, change parts, etc. However, we should report when we see a problem with a mobility device. You may notice things like tips on the canes will wear out. You will also notice sometimes that handbrakes or locking brakes may not be functioning as tightly as they should. You may also notice that a device may become slightly wobbly or unstable. If you notice anything like this, report this to your supervisor right away. Now, it's also our job to make sure that those devices are kept clean. You know, it reflects on us personally as caregivers. Just like you don't want your resident running around in soiled clothing, you don't want them walking around or wheeling around in dirty mobility devices either. So take time to follow the manufacturer's instructions in cleaning a device. Typically, a damp cloth followed by a dry cloth polishing will keep those mobility devices looking great. If your resident requires more than simply reminders to use their mobility devices, you will want to clearly understand how to assist with the device. Mobility devices vary by manufacturer and, of course, by resident need. So always ask your supervisor for clear instructions for assistance with the mobility device that your resident is using. Under no circumstances should you ever misuse a mobility device. Devices have very specific purposes. We should never deviate from those purposes. A very common mistake that is observed is using a walker as a wheelchair or scooter. Even though a resident or family member may ask you to transport a resident in such a fashion, never do that. That is very dangerous. When the resident goes over a threshold or even just scooting along the floor using it as a transport device could result in significant harm. It's important that we store the mobility devices appropriately. It's always a good idea to have the resident's name applied to their walker, cane, etc. Store the device in the resident's own room as appropriate. If a resident gets up independently, you will always want to make sure that that mobility device is within easy reach so they don't have to ambulate a distance without it. You know, one area of concern we have is in our dining rooms. When you have one dining room with many residents using mobility devices, it can also get cramped and crowded. So oftentimes we will store their walkers, etc., off to the side of the dining room while the resident is enjoying their meal. That's fine, but we never want to leave the room unattended when we have removed their mobility devices. We always want a staff person nearby ready to retrieve the mobility device for the resident upon their request. Now, this is particularly true for persons with dementia because they may not think to ask for the device in advance. You may just notice that they're starting to get up out of their chair. That's an indicator we had best go get their mobility device right away. Let's talk about wheelchair use. Oftentimes residents are prescribed a wheelchair, either for part-time use or full-time use. Some residents will only use their wheelchair, for example, when they are out of doors or traveling long distances. Now, I know as a care provider it can be very tempting to use the wheelchair at all times. Let's be perfectly honest. We can have a resident escorted from their room to the dining room much more quickly if we're scooting them along in that wheelchair as opposed to walking with them as they take their time with a walker. But think for a moment, what's best for the resident? In most instances, it is best that the resident always ambulate as much as possible according to physician orders. So never be tempted to overuse a wheelchair. You're only deconditioning and potentially limiting the future ability of that resident to ambulate. As a professional caregiver, we will want to make this transport as positive an experience as possible. Let's begin with explaining to the resident where we're going in the wheelchair. Nothing can be more confusing or frightening, especially to a person with dementia, than to simply be placed in a wheelchair and wheeled away. So always engage the resident in friendly conversation, letting them know where you're going to go to. Once the resident is seated in the wheelchair, again, it's a nice time for one-on-one conversation with that resident as you're traveling about the community. Now be sure to keep safety in mind. For example, when exiting the resident's room into a busy hallway, you may prefer to turn around and exit backwards so that you're not just shoving the resident out into a busy hallway without having clear vision of what may be coming one direction or another. As you go through narrow areas, or especially doorways, be sure to remind the resident to tuck their arms in so that they don't bruise or have a skin tear on an elbow that catches a doorway. You will always want to keep your head up and alert, scanning the area for any hazards, a mop bucket, or anything that might be in the way of the resident. Now keep a good, safe distance between the wheelchair and other residents who are ambulating. If we inch too close, it can frighten the other resident and cause them to become unstable. We never want to infringe upon the space of other residents ambulating in the community. So take your time. There's nothing wrong to pause for a few moments and chat with your resident while others move out of the way. When going around a corner, always check for clearance. And don't take those corners too rapidly. It can be very frightening for the resident and could even result in an accident. Always use footrests appropriately. We never want to be pushing a resident along and having their feet or their heels dragging the ground. Some residents have wheelchairs that are a little bit lower and designed for them to self-propel. They do not use footrests, but rather they scoot themselves along the community, moving about as they wish. Whenever a resident is self-propelling, you will always want to make sure that you survey the scene for safety. Are there any stairs or uneven areas that could pose a danger? Also, be careful of residents that tend to scoot back on their own in a wheelchair. They could easily tumble down a stairway or any uneven area that is nearby. Be sure there are no cords, rugs, etc., again, that could pose a danger when the resident is self-propelling. Residents with dementia will require special monitoring. They may try to get out of their wheelchair in an unsafe manner, or they may unlock the wheels when you are unaware. Always try to position residents with dementia in a line of sight so that you can see them at all times. Sometimes other residents can actually pose a danger to the person in a wheelchair. We will want to remind residents that it's our job to move residents about the community. Let's Let's talk about the special care of residents who are completely dependent upon the use of a wheelchair. Let's first recognize that it is never appropriate that a resident is in a wheelchair for extremely long periods of time. For example, if you wheel a resident to an activity and they are able to safely transfer to the sofa or other comfortable chair, do so. You can imagine yourself sitting in the same chair, in the same position, every day, all day for many hours. That wouldn't be good for any of us. You will want to remind your resident who is in a wheelchair to shift their weight appropriately every few minutes to avoid pressure areas. Always use physician-prescribed cushions, pillows, etc. to help support the resident. We always want to make sure that when the resident is seated in the wheelchair, that their buttocks are all the way to the back of the chair and their arms are comfortable. Slouching, leaning over in a wheelchair is never comfortable for someone. If the resident is incontinent and also fully dependent upon a wheelchair, this even increases risk factors for pressure sores. So you will want to follow the resident's service plan carefully regarding their incontinent care. Skin checks are critically important. If a resident is using a wheelchair frequently, we will always want to check their skin daily. Not just their buttocks and back areas, but all bony prominences, including the heels. If you notice that redness continues to appear in one particular area, observe and let your supervisor know. It could be that the wheelchair is a wrong fit, or it needs to be padded differently. There are other concerns we have when someone is in a wheelchair for long periods of time. Watch for any edema or swelling, especially in the lower legs or feet area. Watch for change in color of skin. Also note any bruising or any other changes that you think are important for your supervisor to be aware of. Remember, it's a good idea to report all changes. Many residents are able to transfer independently from their wheelchair to bed, chair, etc., and back to the wheelchair. Some will use transfer boards that they actually slide or scoot on, while others will require full assistance. Your residents will use walkers, and there certainly is a large variety of styles of walkers. There are 4-point walkers, front-wheeled walkers, tripod walkers, just to name a few. That's why we stress the importance that you need to understand the mobility device that your resident uses and the specific requirements with the use of that device. But let's talk about general use of walkers. We always want to make sure the walker is nearby so the resident has it easily within arm's reach if they are getting up on their own. A resident should always have a walker that has been properly fitted. A walker that is too high causes the resident to walk improperly, as does a walker that is too low can cause unnecessary stooping and will not provide the necessary support the resident may need. When assisting with a walker, you will want to stabilize the walker while the resident stands up and has a firm grip, should they require that level of assistance. Never rush a resident who is using a walker. Follow physician guidelines regarding the amount of assistance the resident will require. Oftentimes, you will simply just walk next to the resident while they're ambulating with their walker. Never pull or tug on a walker, causing a resident to walk too quickly. You may notice a variety of styles of canes. Some of them are very decorative and the residents actually individualize the look of their cane. There are straight canes that are simply a single point cane. Now these type of canes typically only support about 8 to 12% of body weight. So if a resident requires a greater level of stability, they will probably use something called a quad cane or a 4-point cane. Again, make sure that the cane is always within easy reach for the resident to use. A resident should never use their cane to stand up, but rather learn a good safe technique using the arms of their chair. Always follow the advice of the physician or physical therapist working with your resident. strength training period, we have discussed a lot regarding the care of our residents with the use of wheelchairs, walkers, and canes. But you know, there's another aspect we always want to remember. Besides the physical care of our residents, we want to always think about the psychosocial care of our residents as well. For many residents, a newly prescribed mobility device is frankly a source of embarrassment or shame. They somehow feel that they are not as strong as they once were. They somehow feel that they are less a contributor because they're reliant upon a device. Treat the use of an assistive device as a very matter-of-fact occasion. Point out to the resident that many other people use mobility devices and they are truly for their benefit and safety. Now, should you have a resident that continually refuses the use of their mobility device, always notify your supervisor so that the physician can be aware the resident is not using the prescribed device appropriately. Now remember, use of mobility devices is not just in the resident's room or just when we escort them to the dining room, etc. It's a part of everyday living. So if your resident is going on an outing, we want to make sure that mobility device is going along as well. Work with your activity leader. Discuss the need of the mobility device with other staff members in the community so they're all aware the residents are using their devices appropriately. Much success to you as you assist your resident with the use of their wheelchair or other mobility devices.